Foot X-ray versus bunion. Normal foot X-ray. Normal foot X-ray. A foot X-ray is the only way to tell whether you have a bunion. It can show where the bunion is, how large it is, and how far it extends. A doctor will also be able to tell whether there's any pain or numbness in the affected area. A physical examination will also help confirm a bunion diagnosis. A doctor will move the big toe to evaluate its range of motion, as well as whether or not it has pain or numbness or tingling. The doctor will ask about your medical history and examine your foot to rule out other conditions that might be causing the bunion. They can also determine if the bunion is causing pain by looking at the appearance and shape of your toes. A bunion diagnosis is often possible without the use of an X-ray. A doctor will also look at the angles between the bones in your foot to determine if you have a bunion. These angles are called the Hallux Valgus angle and the intermetatarsal angle. A bunion is typically the result of excessive stress on the joint, especially if the big toe has been forced into a pointed toe shoe for long periods of time. When the big toe is in this position, it pushes against the other toes and the bone behind it extends outward like a hinge. This creates a situation where mineral deposits form in the hyperextended joint space, resulting in a bunion. Ossification and bone remodeling are both common causes of this condition and can even occur in childhood. While a bunion may be an asymptomatic condition, treatment for it depends on the severity of the problem. A bunion can be painful and restrict your ability to wear certain shoes. Normal foot X-ray. A doctor will want to see the location of the big toe and whether it has deviated. A bunion will be noticeable on a foot X-ray, but a doctor will not necessarily diagnose it based on this one measurement alone. The other factor to consider is the length of the toes. If they are all pointing out, this means you have a bunion. A bunion is usually not a serious issue, but it is a painful condition. A doctor should be able to determine the exact location of a bunion with an X-ray. A doctor will measure the angles of the bones of the foot, including the big toe. A good foot X-ray will show these angles, which can lead to a bunion. A doctor will also look at the angle between the first and second metatarsals. A bunion may be painful or cosmetic, but a proper diagnosis is best made through a series of tests and a bunion X-ray. If the big toe is not painful, it may be a symptom of a broader bunion. An osteotomy will reduce the size of the big toe, leaving more room in the joint. A surgical procedure will involve placing a silicone wedge between the first and second toes. This will force the big toe to line up with the first metatarsal. A doctor will also measure the angle between the bones in the foot. Normal foot X-ray. This angle can indicate whether a bunion is painful. An X-ray can show where the bones are aligned. This is important for the proper diagnosis of a bunion. If there's an angle between the big toe and the first metatarsal, it may be a sign of a bunion. The angle between the first and second metatarsals is another way to see if a bunion is painful. The angles between these two bones are crucial for diagnosing the condition. Taking an X-ray will give the doctor a better understanding of the cause of the pain and what treatment is best. An X-ray will also help him decide if a bunion is painful. The biggest difference between a bunion and a normal foot X-ray is the angle between the bones. The long metatarsal bone is angled inward towards the second toe. The second metatarsal is angled inward towards the big toe. The MTP joint is often enlarged and inflamed, making it hard to walk properly. If your foot is X-rayed, a doctor will be able to determine if you have a bunion. Normal foot X-ray, normal foot X-ray, normal foot X-ray.